So PMG, we manage multi-million dollar federal grants. Well, the first one that we got was back in 2014 with a group that focuses on women that have had exposures during pregnancy or breastfeeding. They're a group made up of members such as physicians, nurses, genetic counselors, pharmacists, teratogen information specialists, and we've done a lot of work in the past 6 years to help grow them through the federal funds that they've gotten. And because we have that federal funding, we were awarded another contract to help with another HRSA award, which is through an organization that focuses on rural SUD, which is substance use disorder in rural counties. We want to make sure that we work with the goals, not just that the organization has, but how we can tie those into the programs that the funding is supporting. And those federal dollars are going to providers and consumers, and so we want to make sure that we're doing everything on our end to tie it all together. So for grants, we want to make sure that we're bringing in all aspects of the grant management together, so working with stakeholders and the compliance piece of it, as well as the financial aspects. A lot of the principal investigators that we work with on these grants, they serve in the PI role for many awards, so we like to lift some of the administrative burden off of them, and we make sure that they're being good stewards of the funding, and we make sure that we're ensuring all of the coordination and communication is in adherence with federal guidelines. Both of our grants that we work with serve underserved populations or folks who don't have traditional access to healthcare. So one of the groups that we work with, they repeatedly address things such as wildfires, coronavirus, Zika, mental health crisis. They serve people who really need access to these resources. Our studies department for one of the groups that we work with, they aim to fill the gap when there's hard to find information for women who are pregnant and who are dealing with diseases and who need to know if they can take a certain medication. So I like to think, as I've told my kids for the past 13 years of working here, that it's work that matters.